The next muscle we're going to cover is the trapezius muscle. So let's first review where it starts and where it goes. So we know it starts at the EOP, all down the cervical and the nuchal ligament, and then it runs from about T1 all the way down to T12, and then it makes a big fan all the way back. Now, my anatomy teacher, Dr. Nick, wanted me to put this in there because it's a really good way to remember where it attaches to, and it's just a gang sign where you put your thumb on the clavicle, middle of your hand on the acromion, and then the back finger wraps around to the spine of the scapula. Okay? He likes to do it when he teaches. He thinks it's really cool. It is a good way to remember this insertion for this muscle, because then we know it's coming to the spine of our scapula, the acromion, and then down to the lateral third of the clavicle. Now, there's three separate divisions for the trapezius. So we have the upper portion, which most people associate with, this big one up top here, and then we have the middle and then the lower. We all do slightly different functions, so when you're muscle testing these, you have to make sure you're challenging the fiber directions that you want to go after. So let's start with the one up top. To fully shorten this muscle, we'll get her to shrug this shoulder up, and then we're going to bring the EOP a little bit closer and back just a bit. So now we know that muscle's in its tightest, most short position, and this might not be the best view, but I'll show you how it's going to be done. And just because this table's a little bit high, I'm going to put a knee up top. I'll place my right hand on her shoulder, and then my left hand's going to be gliding away, but I don't want her to let me move her in that direction. So hold her nice and strong. I'm trying to push her shoulder down and her head away, and she's contracting her upper trap in order to prevent that from happening. So let's see what that looks like from a different position. We'll do the other shoulder this time, so we'll get her to shrug this side up. We'll bring her EOP just a little bit towards and back. I'm going to place my left hand on her shoulder, try and push down and hold her nice and strong. So again, we're trying to separate these 2 points, and this muscle is contracting to prevent that from happening. This isn't...
You're also engaging where you get her scapula.
Okay, yeah. And up again. So from this position, we're getting a good challenge on the upper trapezius. Keep in mind your levator scap is firing a little bit as well. We'll show a little bit more of a specific muscle test to really isolate that one in a little bit here. So the next muscle we're going to go into is the middle trapezius, which is a retractor of the scapula because it runs between the middle borders of the scapula. So we'll go arm out to the side, and we'll do thumb in neutral, and she can do a little bit external rotation there. And what I'm going to do is try and move her arm forward, and she's not going to let me do that. So I'm just going to slowly load, and then come back out. For the muscle test for the inferior fibers of the trapezius, we'll move the patient's arm right up into this position, slight external rotation. And we know it's coming off the spine of the scapula, running down into the lower T-spine. I'm going to, again, apply a force forward, and she's going to resist that motion. Hold her nice and strong. Now, with respect to testing these muscles, what you usually find is these ones, the upper fibers, are usually quite strong, over-contracted in a lot of people, and because of all the sitting and poor posture, the tightness in the actually anterior part of the shoulder can actually turn off the middle and inferior fibers. So come up again on this side. You'll get usually a pretty solid muscle test when you check the upper fibers, and then when you check these middle and lower fibers, you're not going to get as strong as strong a firing. So I just want to just bring that to your attention, because a lot of people will always just isolate traps up here. Two separate divisions, and you usually get quite a different response when you do muscle tests in them. All right, now I'm going to show you guys a variation for a middle trapezius fiber muscle test in a prone position. So we'll move the patient's arm out to the side, slight external rotation. And I'm going to try and move your arm down. Don't let me do it. And I'm just going to apply a little bit of palpation directly over top of those middle trapezius fibers. And note the functional kinetic chain from the middle trapezius all the way through posterior delt, and as well as a little bit of triceps engaged to resist this motion while we do this muscle test. And in this position, if we want to be even a little more specific on the middle trapezius fibers, we can go proximal to the elbow and do another muscle test there just to see what kind of response we get. Moving into the inferior fibers of the trapezius, we'll do slight external rotation again. And again, we know those fibers are running all the way down here. So again, I'm just going to apply support force there. I'm going to try and push your arm down. Don't let me do it. And again, I can feel that contraction directly beneath my fingers when I do a little load-in with the muscle test. And you guys might not be able to see this on the camera very well, but notice I can clear my hand underneath her arm. Her arm is not resting on the table. It's just slightly off. So she's working pretty hard right now just to hold this position. But that's how we do a proper muscle test, because if you just relax down, if I just push into the table, I'm getting no useful feedback, and these muscles have turned right off. I can feel there's no activity there. Lift your arm back up, boom, and they fire right underneath my fingers. Hold there, And that's how you do the inferior muscle test. Just also want to remind you guys that when testing the muscle fibers for the trapezius in the middle and lower position, where the thumb is can actually change how that muscle fires. Now, of course, we know it doesn't originate or attach to the humerus at all, but for some reason, when we get external rotation, you just get a better firing and contraction of this. So when you do your muscle test, you probably want to make sure the thumbs are up in this position, and as you go down, it actually might be more indicated when you do a rhomboid muscle test. So let's keep the thumbs up when doing the middle and inferior fibers for the trapezius. And it's also something that's done quite a bit as a rehab exercise on an exercise ball, and it's called YTs, W, L, and I. And maybe we'll just get you to hang your arms off the table and bring them straight up. So it would be straight up and out, and then thumbs to the ceiling. That's kind of like the finishing move on this rehab exercise, is then rotate your thumbs back down, and then the arms come back down again. Or you can come straight out to the side, rotate your thumbs up again, and hold. And just notice that good rotation and full contraction all through her upper back here. Rotate back down again, and then you can go straight up. This would be an I, because she's making an I with her body, and then reverse that position. So same thing, it always ends with thumbs up if you want to isolate those trapezius fibers a little better.